Every 4th February is a day set aside to highlight the prevalence of cancer in the society and how it can be managed. The United Nations says the day is an opportunity to rally the international community to end the injustice of preventable suffering from cancer. In Nigeria, cancer patients are not finding it easy managing the ailment due to many factors, which include access to quality Medicare, drugs and funds. TV360's Simisola Adigun in this report looks at what can be done by stakeholders to manage the treatment and prevention of cancer in the country.
According to the United Nations, 17 people die of cancer every second globally. Cancer has also been identified as a new pandemic in Africa due to lack of good healthcare system, professionals, quality drugs, and experts to manage the situation. In 2018, a total of 41,000 Nigerians were killed by cancer out of an estimated 166,000 cases recorded in the country, the World Health Organization said. There are more than 100 types of cancers, but key drivers in Nigeria and most African countries are tobacco use, alcohol consumption, sedentary lifestyle, polluted environment, and unhealthy diets, according to experts.
When you talk of smoking, for instance, obviously that makes them more predisposed to pulmonary or lung cancer. You see, because smoking itself goes to weaken the lung cells. And when it weakens the lung cells, then there may be a mutation, and then it begins to replicate rapidly, and you call that cancer. With alcohol, for instance, it goes to actually destroy the liver. And when it destroys the liver cells are weak and they cannot perform optimally, then you begin to see a situation where rapid replication of those cells will happen, and then you call it cancer.
Cancer is beginning to be a very serious problem in the country. WHO have just released the 2020 cancer incident and mortality, and clearly it shows that the incidence of cancer is increasing in the country. But unfortunately, the health system response to the increase in both cancer death and both cancer mortality is absolutely poor in the country. And COVID-19 have also played a very huge role in disrupting the entire healthcare system.
With one of the world's highest cancer death rates, what can be done to save more patient lives in Nigeria?
If the government can implement a national screening in a way that is very simple, once every woman who already have a breast board comes into the hospital, that woman should be screened for breast cancer and should be screened for cervical cancer, and the woman will instantly receive what we call the human papillomavirus vaccine. This is the first and the most important foundation of cancer control in any part of the world.
If civil society organizations or high net worth individuals can actually come up with a foundation, a cancer foundation, that will be able to bring in all of those heavy treatment alternatives and make them available at subsidized cost, that will help.
This year's theme is I Can, We Can, which acknowledges that everyone has the capacity to address the burden of cancer. The United Nations says all can work together to reduce cancer risk factors and can overcome barriers through early diagnosis, treatment, and palliative care. Simisola Adigun, TV360, Lagos.